Today my topic of discussion is minimally invasive cardiac surgery, that is MICS. First I come to the introduction. Any surgery that is performed through a several small incision instead of traditional open approach is called the minimal invasive surgery, and when this principle is applied in the department of cardiac science, then it is called the minimal invasive cardiac surgery or MICS, where heart surgery performed through several small incisions instead of traditional open sternotomy approach that requires a median sternotomy. Now coming to the history of MICS. MICS started with mitral valve procedure and then gradually expanded toward. So coming to the history of MICS, MICS first started with the mitral valve procedure, then gradually expanded towards the other valve procedure, CABG, that is the coronary artery bypass grafting, and various other types of simple congenital heart surgery, atrial septal defect closure, and atrial tumor dissection like myxoma excision via right antero-lateral thoracotomy. Next is upper partial mini sternotomy, that is also known as hemisternotomy. We perform aortic valve surgery, AVR mainly, patent foramen oval closure, and thymectomy via these approaches. And another approach is the hemisternotomy, that is the lower hemisternotomy, where we can do the mitral valve surgery, tricuspidal surgery, and ASD closure. But mostly the mitral valve and tricuspid valve surgery, ASD closure, VSD closure, usually done via the right anterolateral minithoracotomy approaches. Now coming to the MICS CVG or mid cab, that is done via the left anterolateral minithoracotomy. And another one approach is subsequent incision, where we can do the pericardial window for the pericardial tamponade for draining the pericardial fluid, and we can.
Cardiac surgery no longer means large incisions. Minimally invasive cardiac surgery uses small, precise openings. Advanced instruments and cameras guide surgeons with high accuracy. This approach reduces trauma to the chest and surrounding tissues. Compared to open surgery, incisions are significantly smaller. Patients experience faster recovery and shorter hospital stays. Less pain, minimal scarring, improved outcomes. It's commonly used for valve repairs and selected bypass procedures. Patient selection and surgical expertise remain critical. Minimally invasive cardiac surgery. Precision, innovation, better recovery.
This is the port access endocardial picture. I have already shown picture. Lima harvest via small incision. The key features: Lima can be harvested through several small incisions. It is important to obtain a long length, preferably the entire length of the lima from the origin up to the bifurcation, because if the lima is tethered to the chest wall, it will tend to king, and if the lima is short, it will place the anastomosis under tension. That is always not accepted. And short length of lima will not reach the LAD in patient with distal disease or COPD, where the lung is expanded, and if the lima is with short length, lima will be pushed during inspiration and expiration. A long length of lima always facilitates sequential grafting. In most of the cases, lima is used for diagonal to LAD sequential grafting, and if the lima length is not adequate, we cannot use the sequential grafting. And the risk of coronary steal from patent IMA branches is avoided. That means if the all branches like the proximal bigger branches are not divided from the IMA, then there is risk of coronary steal phenomenon. That means the flow will be diverted to the branches of the IMA rather than going to the coronaries.
Lima harvest, now refined through a small incision approach. A limited anterior thoracic incision minimizes surgical trauma, while providing direct access to the left internal mammary artery. Meticulous skeletonized dissection ensures optimal graft length and flow. Side branches are carefully clipped to preserve conduit integrity. Complete mobilization is achieved with minimal tissue disruption, ideal for minimally invasive coronary bypass procedures. Reduced incision size translates to faster recovery, less pain, and improved patient outcomes. Lima harvest via small incision. Precision meets minimal invasiveness.